your gastroenterologist has never asked you about depression or anxiety, well, you're not alone. And today I'm giving you the exact script to change that at your next appointment. Hi, I'm Kate, and today we're talking about the mental health gap in Crohn's care that affects 4 out of every 10 patients, but gets screened for in almost none. And this matters right now because you might be suffering in silence, thinking it's just you, when actually it's a predictable, treatable part of inflammatory bowel disease that deserves the same attention as your inflammation markers. When my son was 17 and dealing with his worst Crohn's flare, I watched him withdraw in a way that scared me more than the blood tests. He stopped seeing his friends, he'd sit in his room with the curtains closed, and when I asked how he was feeling, he'd say, "Fine," in this flat voice that told me he was anything but. His gastroenterologist was brilliant with the medical side, adjusting meds, ordering scopes, tracking his markers. But in 18 months of appointments, not once did anyone ask about his mental state. Not once did anyone screen for depression or anxiety, even though he was a teenager losing his social life to a chronic illness. I see this pattern constantly. People come to me after years of GI care, and when I ask about their mental health, they often tear up too, because no one's asked them that question before. They've been tracking their bowel movements, their CRP levels, but the anxiety that wakes them at 3 a.m., the depression that makes them cancel plans even on good days, that's been invisible. Here's what most people get wrong. They think if their gastroenterologist isn't asking about mental health, it mustn't be important. Or they think it's separate, like the Crohn's is the real problem and the depression is just their personal failure to cope. But the research is clear. 40% of people with Crohn's disease meet criteria for clinical depression, and that's not weakness. That's not a character flaw. That's inflammation affecting your brain, chronic stress affecting your nervous system, and the very real psychological impact of living with an unpredictable disease. And here's the other thing people get wrong. They think their GI should automatically be screening for this, but the reality is most gastroenterologists aren't trained to do mental health screening. They've got 15 minutes to review your labs, check your symptoms, and adjust your treatment plan. Mental health assessments isn't in their standard protocol, and it's not because they don't care, it's because the system isn't set up for it. So, the real issue isn't that your doctor is ignoring your mental health, it's that you need to actively bring it into the conversation and ask for it to be part of your care plan. And today, I'm giving you exactly how to do it. So before your next GI appointment, write down this exact script and practice saying it out loud. Here we go. I've read that depression and anxiety are common in Crohn's patients, and I'm experiencing, so name your symptom, trouble sleeping, loss of interest in things I used to enjoy, persistent worry about flares, whatever's true for you. I'd like mental health support to be part of my treatment plan. Can you help me with a referral? Notice what this does. You're not asking if it's okay to have mental health struggles. You're not apologizing. You're simply stating a fact about Crohn's, naming your experiencing, and making a clear request. You're giving your doctor a specific action to take. When my son finally had this conversation with his GI, he said, "I'm feeling really low, and I know that's common with Crohn's. I think I need to talk to someone." His doctor immediately said, "Thank you for telling me. Let me get you a referral to our IBD psychologist." It took 30 seconds, but it changed everything. There are several pathways for mental health support, and you want to know which one you're requesting. A referral to a psychologist or therapist who has experience with chronic illness, this is talk therapy, CBT, ACT, or other approaches that help you develop coping strategies. This is usually your first step and the most accessible. A referral to a psychiatrist, if you think you might benefit from medication for depression or anxiety, Well, psychiatrists can prescribe antidepressants or anti-anxiety meds that work alongside your Crohn's treatment, or ideally both. A therapist for ongoing support and a psychiatrist for medication management if it's needed. When you're in the appointment, you can say, I'd like to start with a psychologist who understands chronic illness. Do you have someone you usually refer to, or should I look for someone through my insurance? Now, what to do if they dismiss you? Because here's the hard truth. Some doctors will minimize this. They might say, well, that's normal, you're dealing with a lot, or let's focus on getting your inflammation down first. If that happens, you have this prepared response. I understand that managing my inflammation is a priority, and I'm committed to that. But the research shows that mental health affects outcomes in IBD, and I'm asking for this to be addressed alongside my physical treatment. If you're not able to provide a referral, can you note in my chart that I requested mental health support and it wasn't provided? Now, that last sentence, that's the sentence that's important. When you ask for something to be documented, it changes the conversation. You're making it clear this is a serious request, not just a passing comment. If they still refuse or brush you off, you have options. You can ask your primary care doctor for a mental health referral instead. You can contact your insurance company directly and ask for a list of therapists who specialize in chronic illness, or you can look for an IBD-specific support program. Many hospitals with IBD centers now have integrated mental health services. Now, sometimes doctors need a bit more information to understand what you're dealing with. If your GI seems uncertain or asks, what kind of symptoms are you having? Here are the specific things to mention. I'm having trouble sleeping because I'm anxious about flares. I've lost interest in activities I used to enjoy. I'm avoiding social situations because I'm worried about my symptoms. I feel hopeless about my future with this disease. I'm having intrusive thoughts about my health. These are red flags that tell a doctor this isn't just normal stress. This is clinical anxiety or depression that needs treatment. And here's something I learned with my son. If you're struggling to name what you're feeling, you can say, I'm not okay and I don't have the words for it. I just know I need help. That's enough. That's a complete sentence. Once you have a referral, here's what you're aiming for. Mental health support that works alongside your medical treatment, not instead of it. This might look like seeing a therapist every 2 weeks while continuing your biologic injections. It might look like starting an antidepressant that your psychiatrist has confirmed won't interact with your Crohn's medication. It might look like learning anxiety management techniques that help you cope with the uncertainty of flares. With my son, it looked like this. He continued his medical treatment exactly as prescribed. He saw his therapist weekly for 6 months, then monthly. He learned that his depression wasn't separate from his Crohn's, it was part of the whole picture. And as his inflammation came down and his mental health improved, they supported each other. This is the middle path. You're not choosing between medical care and mental health care. You're insisting that both matter and both deserve attention. And if your current GI can't or won't support that, it might be time to find one who will, because you deserve a care team that sees all of you, not just your colon. Here's where you end up if you follow this plan. You walk into your next appointment with a clear script, you ask directly for what you need, and whether your doctor responds well or not, well, you know your next steps. You're not waiting for someone to notice you're struggling. You're not minimizing your mental health because it feels less urgent than your physical health. And you're treating your whole self with the same seriousness you bring to your inflammation markers. My son is now in deep remission, both physically and mentally, but that second part didn't happen by accident. It happened because we stopped waiting for someone to ask and we started asking directly. And that's what I want for you. So if this helped, share it with someone who needs it. Send it to the person in your support group who's been talking about feeling low. Send it to your friend who's struggling but doesn't know how to bring it up with their doctor. And if you want more support navigating that mental and physical sides of Crohn's, that's exactly what we do in the Crohn's Method community. I'll see you in the next video. And always have a beautiful day.